You're watching On Air podcast right here. Make sure that you subscribe to our YouTube channel. मेरो BMI गर्दाखेरि 20 भनौँ न let's say okay I'm way less now and let's say I'm like 30% 30 पनि 28% रे हैन BMI मा छ भने हैन कति % चाहिँ निस्किन्छ त मेरो त्यसको मतलब त्यो एउटा गिभ और टेक गर्दाखेरि के
BMI is just one of the indicators of how much fat you can take out, but that you cannot calculate on BMI because more important is how thick is your fatty layer.
Interesting.
Because if you talk about BMI, then what about your density of your bone? What about the fat inside the body and not in the superficial fatty system under the skin? So there is a lot of fat inside your abdomen. Pet vidra. Or the whole heart is actually covered by fat. The whole, the abdominal, हाम्रो पेट छ नि पेटको जुन इन्टेस्टाइनहरूलाई कभर गर्ने जुन लेयर छ नि त्यो पुरै फ्याटी लेयर छ क्या त्यो ओमेन्टम भन्छ त्यसलाई इट्स फुल अफ फ्याट सो फ्याट त इनसाइड पनि छ एन्ड आउटसाइड पनि छ सो BMI त अब त्यो इनसाइडको फ्याटले पनि त कन्ट्रिब्युट गर्छ नि त सो इट्स the outside fat is not an indicator. More important is how thick is your fatty layer under the skin.
Okay.
That will determine the amount of fat we can take out. For example, we had a lady who she looked, she had a lot of, by the way, she had a lot of fat. And then we did liposuction. Thighs bada matrai, duita thighs bada matrai. We could take out 3,600 ml. 3 liters, 3.6 liters.
3.6 liters of fat.
Yeah. Just per thigh.
Oh my God. कति समय लाग्यो यो गर्नलाई यो सर्जरी गर्नलाई
1.5 hours, 2 hours I think.
2 hours.
Yeah, 1.5 hours, 2 hours.
And how did it make her feel after the surgery? Let's say एक हफ्ता पछि भनौँ न or 10 दिन पछि.
Immediately after the operation, when she woke up and she was alert enough to stand and go to the washroom, she felt that her thighs are very nice. She was so happy.
Liposuction immediate पनि भइहाल्छ.
Immediately थाहा हुन्छ.
Yeah.
3.5 liter.
3.5 liter.
Jesus, 3.5 liters of fat.
From thigh.
And
both thighs.
And instant त्यो awareness भइहाल्छ.
Instant awareness, yes. Instant. Because उहाँले जुन लुगा लाउनु भएको थियो, she could feel that now the luga, the clothes are...
surgery, the swelling usually
immediately the swelling. So when she's awake, she was like, very happy. But then after 2 days, 3 days, there's going to be some swelling for some time, which you will recover after that. And then I think she was from America and she's already gone back.
What are
very happy.
What are the risks of liposuction?
Number one, deformity. Okay. If I try to take out too much of fatty, superficial fat, like I mentioned, then there's going to be, valleys, dimples, sort of thing, from where you took out. So that's called contour deformity. So I always be very careful of which layer I take out. And that's number one, because ladies would like to have a very nice contoured, it should not be dimple भएको थाई त चाहिएन नि त उहाँलाई so dimple भएको पेट चाहिएन नि so that is very, very important. And the other thing is after liposuction you're going to feel very, very thirsty. के हुन्छ भने liposuction गर्दाखेरि चाहिँ fat निकाल्दाखेरि चाहिँ you're taking out a lot of fat and it causes some it will result in some metabolic little bit of metabolic disarrangement हुन सक्छ के so त्यसले गर्दा चाहिँ हामीले चाहिँ अब चाहिँ ड्रिपहरु दिन्छौं and then we tell her to take adequate diet, salt, potassium भएको तत्वहरु like bananas and so on. So they maintain, and thank God everything is okay till now.
Interesting. So you've done a lot of liposuctions in
हजुर.
Kathmandu in Nepal.
हजुर.
Interesting. तपाईले हाम्रो क्लिप एकदमै एन्जोय गर्नुभयो होला. अब पुरै भिडियो हेर्नको लागि चाहिँ युट्युबमा सब्स्क्राइब गर्न नबिर्सिनु होला. This program is brought to you by Vyas Studios.